Emergency physicians offering first-line treatment for concussions aren't always providing the proper discharge instructions. That's according to Dr. Eileen Claudius, assistant professor of emergency medicine at the University of Southern California. At the 2013 Advanced Pediatric Emergency Medicine Assembly, Dr. Claudius said specific instructions are crucial to preventing any further injury.
30% of kids with concussions are discharged from the emergency department without discharge instructions. And I'm sure they're given discharge instructions, but maybe not the appropriate discharge instructions specifically for a concussion. Our biggest role, once we've ruled out an intracranial injury, is really to make sure that that kid doesn't leave the emergency department and, while still symptomatic, go back to play the next day. And there is a specific graded return to recovery where they sit out of play till they're asymptomatic, and then they progress up through light aerobic exercise, sport-specific exercise, non-contact training drills, full contact practice, and unrestricted return to play, waiting at each level till they're asymptomatic for 24 hours. And if we want to go into that degree of detail from the emergency department, I think that's fine. If we want to just say, don't go back to play until you've cleared it with your pediatrician and put the onus on them to go through it, I think that's fine as well. But I think letting families leave the emergency department without giving them appropriate instructions on how important it is to avoid a situation where the kid's going to have a second head injury is problematic.
Dr. Claudius also offered some tips for physicians who may be called to consult on a possible concussion during a sports game.
If a physician's on the sideline, or a PA, or any medical practitioner that's called to evaluate a patient who's been injured in a game, if there's any question that that child has a concussion, they should not return to play that day. They may or may not need to go see a medical provider at that point. They may or may not need to see their pediatrician or primary care provider the next day, but certainly they shouldn't be returned to the game the same day. If there's a question as to whether or not the child sustained a concussion and a disagreement as to whether or not they should return to play, that gets a little bit more difficult. So the practitioner can delve into the symptoms of the concussion to see if the child has any memory losses, poor reaction time, any somatic symptoms like a headache or dizziness, any behavioral changes, irritability, anything like that that might denote a concussion. If those are negative, but there's still a concern, there are some questions that can be asked. There's something called the SCAT-2 that has Maddox questions in it, basic questions about where they're playing and who won the last game that the athlete can be tested with just to make sure that they are at least having a baseline ability to remember and process. And there's something called BEST testing, which I think is what you talked about with the 15 minutes, where you give them a little 15-minute break to recover, and then you test their balance by having them assume a series of stances. Probably the easy and quick way to do it is to just have them do a tandem gait with their non-dominant foot in front, their hands on their hips, and their eyes closed. And if they can't hold that position for 20 seconds without making 5 or so errors where they have to open their eyes, or they stumble, or they have to right themselves, then that's an indication that that patient's been concussed and should pretty much definitively be removed from the game for the rest of the day. I think sort of what has more impact when you're actually talking to families and patients is, I always ask the family, is your kid getting scouted? And when they say no, because it's very rare that kids actually getting scouted the day I see them, I said, well, do you expect that that might happen? Most families think that their kid's going to college on a college scholarship for athletics, regardless of the child's actual athletic ability. So I then point out to them that if they give the kid time to recover now, that when they get scouted later in the season, they're not going to be performing poorly because they've allowed themselves to not recover and have multiple concussions. And the day the scout comes, they're having a poor reaction time and they have a bad game. And I think that's probably been my best strategy in convincing families. I did have one unfortunate situation where the kid actually was getting scouted, but we had a long talk about it, and I think those are the situations with elite athletes where maybe you do need to get a specialist on board, and you need to do the neurocognitive testing, and you need to do some of the functional MRIs and things that are really reserved for those very specific, delicate situations.
With ASAP News, this is Frances Correa.